this video I'm going to tell you what ADHD is, explain the biology behind it, and tell you about various possible treatment and management options. I'm also going to tell you a bit of my story and experience with ADHD. Before I start, I want to state that I do not intend to diminish or deny the necessity of your medication or appointments with certified medical practitioners, for I'm not one. While writing the article, I used and quoted various articles. All the references could be found in my article. The link to the article is in the video description. This video follows a specific narrative structure, and you can always navigate through chapters in the video description. ADHD, or Attention Deficit Hyperactivity Disorder, is a developmental disorder associated with an ongoing pattern of inattention and/or hyperactivity and impulsivity. ADHD can severely interfere with an individual's daily life and relationships. ADHD usually begins in childhood and can continue into the teen years and adulthood, although sometimes ADHD can occur in the adulthood. Some people with ADHD do not know they have it. These people may have difficulty staying organized, sticking to a job, or remembering keeping appointments. They possibly struggle with mundane tasks, be it their job or daily routine. These people may have a troublesome history with school, work, relationships. Adults with ADHD might seem restless and may attempt in doing several tasks at once, and a great deal of them may be left abandoned. They sometimes prefer fast steps to get quick results rather than walking a journey to reap greater rewards. A person might not be diagnosed with ADHD until they're adult, because teachers or family did not recognize the condition at an earlier age, or they managed fairly well until they got acquainted with the demands of adulthood, for example, at work or college. It is never too late to seek a diagnosis and treatment. Effective treatment can be a lifesaver. ADHD, or Attention Deficit Hyperactivity Disorder. Or is it Attention Deficit Disorder, ADD? What is the difference, you might ask? In 1994, doctors classified all attention deficit disorder forms to be called Attention Deficit Hyperactivity Disorder, or ADHD, even if the person is not showing signs of hyperactivity. Now it is called ADHD Inattentive type, or ADHD Hyperactive-Impulsive type, or ADHD combined type. People with ADHD experience a certain pattern of symptoms depending on their ADHD type. Inattention, disorganization, problems staying focused, constant daydreaming, not paying attention when spoken to. Impulsivity, instantaneous decisions without thinking about the consequences, acting fast to get an immediate result, interrupting people. Hyperactivity, squirming, fidgeting, tapping, talking, and constant movement even when not appropriate. Some people with ADHD mostly have symptoms of inattention, others mainly have hyperactivity and impulsivity symptoms. Some people have both symptomatic vectors. People with ADHD inattentive type may find challenging to pay close attention to details, follow instructions, sustain attention while executing lengthy tasks, listen closely when spoken to, organize tasks and activities, manage time, and easy to make careless mistakes at work or doing other activities, lose personal belongings, be easily distracted by irrelevant tasks or stimuli, be forgetful in daily life. Signs of hyperactivity and impulsivity for people with ADHD hyperactive-impulsive type may include extreme restlessness, difficulty staying still for a long time, fidgeting with or tapping hands or feet, squirming, being unable to quietly execute leisure activities, excessive talking, answering questions before they are asked completely, having difficulty waiting one's turn, such as when waiting in line, interrupting others. Other concomitant mental disorders, including anxiety, mood, and substance use disorders. Inattentive ADHD. Inattentive ADHD, formerly ADD, is a subtype of ADHD that often evinces as limited attention span, distractibility, forgetfulness, procrastination. People with inattentive ADHD are prone to making careless mistakes due to lack of stable focus. They have a hard time following detailed instructions, organizing tasks and activities. They are easily distracted by external stimuli, and sometimes lose their belongings. They might leave projects incomplete and appear not to be listening when you talk to them. These are all symptoms of inattentive type ADHD. They're not personal defects. A student with inattentive ADHD may look out the window, leaving his work unfinished. This daydreaming behavior is overlooked or mischaracterized as laziness or apathy. According to the National Institute of Mental Health, inattentive ADHD symptoms are far less likely recognized by parents, teachers, and medical practitioners. As a result, people with ADHD rarely get the treatment they need. This leads to academic frustration, apathy, and shame that can last a lifetime. A child with inattentive ADHD may rush through a quiz, missing questions, even when he knows the answer, or he might skip whole sections in haste. As an adult, he may fail to carefully proofread a document or email at work, drawing unwanted attention and feeling embarrassment. If you try hard to slow down and pay attention, trying to live in the moment but find it uncomfortable and even painful, then it's a big sign you've got inattentive ADHD. Incomplete and half-done projects and assignments are hallmark signs of attention problems in students. Adults with inattentive ADHD can stand boring work meetings much more than their colleagues. They need to be chewing gum, sipping coffee, and even standing during meetings in order to sustain their attention. If you are consistently frustrated by your inability to maintain stable focus while reading long documents, listening to people during meetings, or doing lengthy projects, this could be a sign you have inattentive ADHD. Students with inattentive ADHD typically may get around half the instructions given to them, if not less. Their notebooks are filled with more doodles than notes, and they might need to record and re-listen lectures several times in order to absorb all the information. While not studying, people with inattentive ADHD tend to have certain troubles socializing, constantly forgetting faces and names, zoning out of conversations while seeming distant and apathetic. If you're consistently being asked something like, "Were you not listening?" then it might just be another sign you have inattentive ADHD. For children and adults alike, inattentive ADHD can manifest itself as various projects lying around in states of completion. If you love to plan and start projects but get distracted and leave a trail of unfinished business, then you might have inattentive ADHD. Do you keep losing your personal belongings, your keys, your smartphone, etc.? Does your home look topsy-turvy on a regular basis? These are signs of inattentive ADHD as well. Misplacing things like smartphone in the refrigerator or a roast beef in a gym bag, hey, everything's possible with us ADHDers in it, also makes just another sign of inattentive ADHD. Please note that food misplacing, such as a pineapple pizza or pickles with chocolate, are not signs of ADHD. They're simply gastronomical perversity. Hyperactive-Impulsive ADHD. Fidgeting or continuously tapping fingers on a table, as well as leg bouncing while seated, can denote a hyperactive ADHD brain. People with ADHD struggle to sit still, as their brain is usually overstimulated, trying to find a way to release energy. They tend to feel restless, constantly urged to move. When people with ADHD cannot release the excess of energy, they might struggle to relax. Even though being idle and not doing anything, their hyperactive brain might pick up ideas and overthink a lot. Impulsive behavior is another sign of hyperactive-impulsive ADHD diagnosis. Patient self-control can sometimes affect others, as they may miss social cues. It often disrupts conversations. This lack of impulse control can also evince in excessive talking without realizing it might not be appropriate. Another manifestation of hyperactive-impulsive ADHD would be the tendency to overshare thoughts, disclose personal information when not needed, or chat with anyone without being asked. Patients' impulsive ADHD urges them to speak without thinking first. They might as well not know when to stop talking too. Such difficulty in controlling these behaviors may cause them to conflict within society, make other people feel disregarded and disrespected. Sometimes they miss the opportunity to be mindful of their thoughts and words and how they might affect people around them. When people think about attention deficit hyperactivity disorder, They may feel that someone diagnosed with it is constantly lively and enthusiastic, never running out of fuel. However, this is a misconception. Because of patients' difficulty relaxing and staying still, they might become tired or exhausted. Many people with predominantly hyperactive impulsive presentations may seem to be more energetic. However, when they need to rest, their hyperactive brain still functions, even during sleep, significantly affecting their energy levels. Another impulsive behavior that might make people feel disregard is when people with ADHD don't let other people finish what they're saying, sometimes blurting out the answer to what they're going to say. This can be frustrating for everyone. As a child, patient can be disrupting the entire class, blurting out answers where he is not asked. As an adult, the person with ADHD can break the natural flow of a conversation or interrupt speech during a walking. Aside from impulsivity, the other reason for doing so could be forgetfulness. The person simply wants to say something before he forgets it. When someone has hyperactive impulsive ADHD symptoms, risky behavior often takes place. Risky behaviors due to hyperactivity and impulsivity could manifest as reckless driving, uncontrollably spending money, or interrupting people during a conversation. Possibly the most common symptom. ADHD Biology. ADHD brain is not wired the same way as the brain without ADHD. Science suggests that specific differences in the brain structure, function, and chemistry may be caused by ADHD. Scientists found out that various medical conditions are linked to low level of chemical messages in the brain, known as neurotransmitters. Such disorders include anxiety, depression, Alzheimer's disease, mood disorders, and ADHD. One of the most drastic differences between an ADHD brain and a normal brain is the level of norepinephrine. Norepinephrine is created from dopamine. Since the two are related, it's believed that lower levels of dopamine and norepinephrine are both linked to ADHD. Imbalance in transmission of dopamine in the brain might be associated with ADHD symptoms, including inattention and impulsivity. This disruption may also interfere with dopamine reward pathway, altering the perception of reward and pleasure. Structure of brain with ADHD can also differ from a non-ADHD brain in certain areas, including the following. Frontal cortex regulates behavior, emotions, and attention. Limbic regions influences emotions and motivation. ADHD-related changes to this area can contribute to hyperactivity, inattention, and worse decision-making. Basal ganglia, responsible for motor learning with skill. It also helps regulate behavior, emotions, and ability to plan, focus, and multitask, all of which are affected by ADHD. Another drastic deviation involves default mode network (DMN) of the brain. DMN activates when one's daydreaming or is not focused on a task or activity. In ADHD, DMN is more often activated. As a result, one might feel that the focus is constantly being shifted from his current task towards unrelated thoughts. Thus, staying focused on a tedious or repetitive task can be troublesome. A brain with ADHD differs from a non-ADHD one in many ways. Size, activity levels of certain regions, chemical signals turning throughout the brain. Because of this difference, one might find it challenging to organize, plan, focus, and manage his emotions. Let's dive deeper into what structure, network, and chemistry of the brain with ADHD look like. Human brain is divided into different sections, lobes, one of which is the frontal lobe. It controls key functions related to planning and organization, focus and attention, self-monitoring and self-control, memory, communication, problem-solving, impulse control, language, social behavior, motivation, judgment. Frontal lobe is the largest part of the brain affected by ADHD. This part of the brain may mature at a slow pace or show disrupted activity and connectivity in people with ADHD. That's why staying focused, planning, and controlling impulses can be challenging for ADHDers. Groups of nerve cells, neurons, form networks in human brain. These networks are responsible for relaying signals throughout the brain via chemical messages. In brain with ADHD, imbalance in function and structure of these networks may cause the brain to transmit messages less effectively. Scientists found deficits in neural networks linked to attention and executive function in people with ADHD. This may affect one's ability to organize, prioritize, plan, focus, remember instructions, and work towards goals. Additionally, ADHD may alter network connections between prefrontal cortex, a section of the frontal lobe, and other areas of the brain. Scientists believe this is associated with poor planning, distractibility, impulsivity, and forgetfulness in ADHD. Other deficits in networks of the frontal and parietal brain lobes can affect patients' attention, motivation, and ability to control his responses and predict difficulty of a task. It may also change how he makes decisions based on perceived rewards. Norepinephrine has significant function in the prefrontal cortex, and ADHD may disrupt its transmission in the brain. This could make it harder to retain information in order to complete tasks. It might as well impair a patient's inhibitory control, which is how one can suppress distractions, urges, or behaviors that interfere with his goals. Meanwhile, dopamine helps to regulate one's emotions and is linked to feelings of pleasure and reward. In ADHD, levels of dopamine in the brain might be lower. This makes it more difficult to maintain motivation, especially when the rewards seem too little or not immediate. ADHD brains tend to favor short-term, smaller rewards over long-term, larger ones. Causes. Scientists are studying causes and risk factors of ADHD. Causes and risk factors are currently unknown, but research shows that genetics play an important role. In addition to genetics, scientists are studying other possible causes and risk factors, including brain injury, exposure to environmental risks, e.g. lead, during pregnancy or at a younger age, alcohol and tobacco use during pregnancy, premature delivery, low birth weight. Treatment. While ADHD is considered uncurable, symptoms can be managed long-term. The best treatment strategies for ADHD show to be multi-approach ones. Combinations of several different complementary methods that work together to reduce symptoms. One person, this may include medication, nutrition, exercise, and behavioral therapy. For somebody else, it might mean taking certain supplements and vitamins, practicing mindfulness, and spending time outdoors in nature. Adult and child patients are increasingly pairing stimulant medication with digital therapies like Endeavor RX, which is available by prescription for patients of age 8 to 12, or principal apps like Endeavor OTC, a new mobile video game designed to improve focus in adults with ADHD. Medication. For children age of 6 plus and adults, medication may be crucial. Finding the right drug typically involves some trial and error, but can lead to a significant reduction in symptoms. Two main types of medication used to treat ADHD are stimulants and non-stimulants. Central nervous system stimulants like Ritalin, methylphenidate, or Adderall, amphetamine salts, are the most prescribed ADHD medications. These ADHD medications work by increasing the amount of dopamine and norepinephrine in the brain, which help with focus. There are three categories of stimulant medications: short-acting, taken a few times daily; intermediate-acting, taken less often; and long-acting, taken once a day. If stimulant side effects are problematic or they're simply not effective, your doctor may suggest non-stimulant medication like Strattera, atomoxetine, or intuinide, guanfacine. Non-stimulant ADHD medications are considered second or third line treatments because benefit and response rates are significantly lower. Stimulant medications are more effective at relieving symptoms for a larger fraction of people. ADHD medications can have many benefits as well as side effects. The decision to manage ADHD symptoms with medication can be a difficult one. Have a look at this medication list of ADHD portal. Cognitive Behavioral Therapy (CBT). According to the Centers of Disease Control and Prevention (CDC), behavioral therapy and cognitive behavioral therapy are helpful in reducing symptoms in children with ADHD. According to American Academy of Pediatrics, behavioral therapy should be the first step in treating ADHD in young children. Although, according to the Child Mind Institute, there is less evidence of effectiveness of cognitive behavioral therapy for teenagers than there is for kids. There are various forms of behavioral therapy. But here I'll focus on cognitive behavioral therapy and dialectical behavioral therapy. Cognitive behavioral therapy is essentially brain training. It is a goal-oriented variety of psychotherapy that aims to change negative thinking patterns and reformulate the way a patient feels about himself and his symptoms. CBT does not treat core symptoms of ADHD, such as inattention, hyperactivity, impulsivity. It rather helps to reduce life impairments experienced by people with ADHD, such as procrastination and poor time management. There is no evidence CBT can replace drug therapy for ADHD, but research suggests it helps adults with ADHD more than other therapy forms do. A 2010 study by Boston's Massachusetts General Hospital found that a combination of drug therapy and CBT was more effective at controlling ADHD symptoms than drug therapy alone. An effective CBT program will help adults with ADHD correct the following distorted thought process and more: all or nothing thinking, viewing everything as entirely good or entirely bad. If you don't do something perfectly, you fail. Overgeneralization, seeing a single negative event as a part of a pattern. For example, you always forget to pay your bills. Mind reading, thinking you know what other people think about you or something you've done, and it's bad. Fortune telling, forecasting that things will turn out badly. Magnification, minimization, exaggerating the significance of minor problems while trivializing your accomplishments. Should statements, focusing on how things should be, leading to severe self-criticism as well as feelings of resentment towards others. Comparative thinking, measuring yourself against others and feeling inferior, even though the comparison may be unrealistic. Dialectical Behavioral Therapy (DBT). Dialectical Behavioral Therapy (DBT), like CBT, focuses on social and emotional challenges associated with ADHD and other neuropsychological disorders. Founded by Marshall Linehan, PhD, ABPP, a professor of psychology at the University of Washington and founder of the Linehan Institute, DBT was initially designed to treat harmful behavior of patients diagnosed with borderline personality disorder (BPD). It is now one of the most successful treatment options for improving emotional regulation. DBT is taught in a series of skill-based modules in weekly group sessions, each focused on a particular skill. Individual therapists provide additional support to personalize the use of the skills in life situations. ADHD coaching. ADHD coaches help children, teens, and adults with ADHD organize and take charge of their lives. More specifically, coaches can help their clients achieve emotional, intellectual growth, strong social skills, effective learning strategies, compelling career and business exploration, and thoughtful financial planning. A professionally trained ADHD coach can realistically assist his or her ADHD clients in building skills like time, task, and space management, motivation and follow-through, developing systems for success, healthy communications and relationships, strategic planning and perspective, making conscious and wise choices, a simplified and more orderly life, achieving a balanced, healthy lifestyle. One of the best ways to find an ADHD coach is through the ADHD Coaches Organization (ACO). This worldwide professional membership organization offers resources for coaches and those who seek them alike. Neurofeedback. Neurofeedback utilizes brain exercises to decrease impulsivity and increase attention in ADHD patients. Neurofeedback trains the brain to emit brainwave patterns associated with focus, rather than those associated with daydreaming, helping rein ADHD symptoms like impulsivity, distractibility, and acting out. Patients wear an electrode-lined cap while performing a cognitive task, such as reading aloud. A computer then reads brain activity and maps areas of the brain where there is too much or too little brainwave activity, which are theoretically sources of the patient's ADHD symptom. This digital map allows a comparison between the patient's brain activity with other brainwave patterns in database, which helps fine-tune a treatment plan by indicating sites for application of electrodes. Patients wear the same headgear while sitting in front of a video screen during treatment. Their goal is to move characters in a video game. goals differ according to the protocol doctors utilize for emitting short pulses of sustained brainwave activity in those areas of the brain thought to be under-aroused. Software monitors and records brain activity. Loss of focus will cause the game to stop. The game only goes on when the patient exercises the area of the brain that is focus deficient. Neurofeedback is criticized. There are some reasonable points to acknowledge. Unlike medicine, neurofeedback therapy was not rigorously tested in large double-blind studies. Some experts say that from the studies it isn't clear whether problems in children are due to therapy or to one-on-one time with the therapist. Another objection is, while neurofeedback might increase attention in some patients, it doesn't always improve other issues associated with ADHD. Some experts say that while neurofeedback has potential, it should be only used together with medicine. One promising aspect of neurofeedback is that its benefits seem to remain after the treatment is ended. Vincent Monastri, PhD, founder of the FBI Attention Disorder Clinic in Endicott, New York, and author of Parenting Children with ADHD 10 Lessons That Medicine Cannot Teach, conducted a year-long and controlled study with 100 children who had taken medication, half of whom also received neurofeedback. Monastri's results indicate that patients who did not receive the therapy lost most of the positive effects of treatment 1 week after they were taken off the medication. Those who combine medication with neurofeedback, he says, maintain their ability to control attention. In fact, says Monastri, who is practitioner of neurofeedback and other therapies at his clinic, after the year of neurofeedback therapy, some patients were able to reduce medication dosage by about 50%. The downside of neurofeedback, though, is its price, which approximately ranges from $2,000 to $5,000 in the 4 course of treatment. Other. Various options of alternative therapy exist, such as play therapy, music therapy, art therapy, or even equine therapy. There is also limited evidence yoga might help as well. If you or your kid are suffering from ADHD, some of it might be worth a try. After all, combined therapy has proven to be more effective than a solo approach. Placebo treatments. Along with various treatment options that might ease up patients' ADHD symptoms, there are also remedies that do not work, despite some people might recommend it. I mean, they could work no more than would a placebo. Feingold diet would be an example. Years ago, Dr. Ben Feingold, an allergist, created a popular diet designed to treat hyperactivity by means of eliminating certain food additives out of the diet. Feingold diet excludes artificial colorings, flavors, and preservatives in order to allegedly decrease hyperactivity. While most scientific studies have refuted Feingold's theory, some parents who have tried it say they notice an improvement in their child's behavior. Although some experts do not think it is the dietary shift that makes a difference. A popular theory is that a child's behavior improves because the parents treat their children differently when they're following a special diet. Speaking of dietary supplements, there is no proof that supplements ginkgo biloba, St. John's wort, or pecnogenol treat ADHD symptoms. OCD and ADHD. Obsessive-compulsive disorder (OCD) and attention deficit hyperactivity disorder (ADHD) are considered pretty common and serious neuropsychiatric disorders. Some of the symptoms associated with attention and concentration might appear astonishingly similar, especially in children and adolescents. OCD and ADHD are, however, very different in terms of brain activity and clinical picture. ADHD is externalizing disorder, which means it affects how people outwardly relate to their environment. Individuals with ADHD might exhibit inattention, lack of impulse control, and risky behavior, whereas OCD is characterized as an internalizing disorder, meaning individuals with OCD respond to anxiety-producing environments by turning inward. OCD patients exhibit frequent obsessive and/or compulsive thoughts and behavior. Typically, people with OCD have a tendency to have a more inhibited temperament and avoiding risky or potentially destructive situations. Additionally, individuals with OCD tend to be overly redundant with consequences of their actions and tend to not be impulsive. Not surprisingly, people with OCD exhibit unusually low rates of novelty-seeking behavior and cigarette smoking. There is a robust amount of evidence that ADHD and OCD are characterized by abnormal brain activity in the same neural circuit. Specifically, both conditions exhibit opposite patterns of brain activity in the frontostriatal system, the segment of the brain responsible for higher-order motor, cognitive, and behavioral functions. However, similarities between OCD and ADHD are limited to only which part of the brain is affected. Patients with OCD exhibit significantly increased activity, hypermetabolism, in the frontostriatal circuits, meaning this part of the brain is overactive in people with OCD, while patients with ADHD exhibit decreased activity, hypometabolism, which means this part of the brain is less active in people with ADHD. While the disorders are associated with very different brain activity patterns, the resultant cognitive effects are somewhat similar, especially in executive functions, such as response inhibition, planning, task switching, working memory, and decision making. Patients with both OCD and ADHD have consistently and significantly underperformed in tests of such skills. Research has suggested that OCD and obsessive-compulsive spectrum disorders fall upon a compulsive-impulsive continuum. In other words, there exists a gradient of disorders ranging from behavioral impulsivity to compulsivity. OCD appears to lie at the compulsive end of the spectrum, while ADHD exists at the impulsive end. This is surprising taking into account that over 35 studies have reported an average of 21% of children and 8.5% of adults with OCD also have ADHD. A question arises: can one person be both impulsive and careful, a person who both takes and avoids risks, and inhibits opposite patterns of brain activity simultaneously? As a second question, if this is indeed possible, how can we account for the significant decrease in reported comorbidity rates in adulthood? Do two-thirds of children diagnosed with both disorders get rid from one of the conditions? These two questions were at the focus of the research into the association between ADHD and OCD by Dr. Dmitriy Ershov and Andrew Middleman. In order to answer the first question, they examined the hypothesis that different mechanisms in OCD and ADHD might result in similar cognitive impairments. In other words, despite the disorders are associated with different patterns of brain activity, they may result in the similar effects on a person's cognitive functioning. This hypothesis is in line with other research suggesting that very different disorders are characterized by impairments in executive functions, although they might differ in patterns of brain activity in the clinical picture. For example, in spite of very different symptoms, post-traumatic stress disorder, major depressive disorder, panic disorder, schizophrenia, and bipolar disorder are all characterized by impairments in executive functions and abnormal patterns of brain activity. Additionally, across conditions, trait and state anxiety has been associated with cognitive impairments. Thus, aforementioned researchers have proposed an executive overload model of OCD. The executive overload model suggests that OCD patients experience an overflow of obsessive tasks. This overflow, which was found to correlate with increased frontostriatal brain activity, results in an overload upon the executive function, which is reflected in executive impairment, resulting in changes to a person's behavior and abilities. Generally, anxiety is known to put strain on the executive system, and Dr. Ershov and Andrew Middleman argue that obsessions may be similar to anxiety in regards to their associated cognitive cost. Specifically, individuals with OCD are demonstrating deficits that aforementioned scientists believe are actually caused by symptoms themselves. A good analogy for the OCD executive overload model would be a computer's RAM. The more background processes take place, the less processing power is available to support computations. Think of your window browser crashing because you have too many programs running. In OCD, a person may perform a certain task while at the same time experiencing a surge of intrusive thoughts. Thus, the more obsessive intrusive thoughts that an individual experiences in a given moment, the fewer resources would be available for other tasks, like listening to a teacher in class or concentrating during a business meeting, especially complex ones. In other words, cognitive impairments in OCD are largely state-dependent. Thus, the model predicts that treating and reducing OCD symptoms ought to be accompanied by an improvement of executive functioning. This progression has indeed been observed in patients undergoing OCD treatment, where, in conjunction with clinical improvement, CPD resulted in decreased abnormal brain activity and improvement in cognitive symptoms. Researchers' direct comparison of the ADHD and OCD groups yielded an association between obsessive-compulsive symptoms, and executive function impairments only within the OCD group and not in the control or ADHD groups. Aforementioned scientists observed that deficient performance on tests of executive functions was correlated with the presence of OCD symptoms, but only within OCD group. In other words, for people with OCD, an increase in reported obsessive-compulsive thoughts and behavior also meant a decrease in performance on executive function tests, such as ability to suppress responses. However, in ADHD group, more OCD symptoms were actually correlated with better performance in tests for executive functions. One hypothesis has suggested that this may be because individuals with ADHD who exhibit OCD traits as well are better organized and more attentive to details than individuals with ADHD who exhibit no OCD symptoms. In the second study, Andrew Middleman and Dr. Abramovich examined the nature of ADHD symptoms throughout the lifespan. They noted that ADHD symptoms were correlated between childhood and adulthood in ADHD and control groups, but not in the OCD group. This second study suggested that some attention problems in children and adolescents might actually stem from OCD symptoms and are not related to ADHD. The second question regarding comorbidity of OCD and ADHD has yet to be answered. Upon reviewing literature, it could be understood that firstly, research reporting prevalence rates of ADHD-OCD co-occurrence exhibit a significant inconsistency, with reports ranging from 0% to 59% of concomitant OCD-ADHD diagnosis, whereas research suggests that 1 out of 5 children with OCD has co-occurring ADHD, but only 1 out of every 12 adults with OCD has ADHD. So, what happens to half the children with OCD who initially diagnosed with ADHD as well? Does it disappear in the adulthood? The answer appears to be both affirmative and negative. It appears that pre-adolescent children with OCD go through a slower brain development process in which brain activity patterns and associated symptoms may resemble symptomatic description of ADHD. However, through adolescence, this arrested development begins to abate as ADHD-like symptoms dissipate and brain activity changes to fit those of adults with OCD. Furthermore, according to Dr. Dmitriy Ershov and Andrew Middleman, a full-blown dual diagnosis of ADHD and OCD in adults may be rather rare and is usually associated with a mediating conditions, notably chronic tic disorder or Tourette syndrome. The way in which neuropsychological disorders manifest in a person's behavior is universal. For instance, a deficit in attention, regardless of the cause or condition, may cause an individual to appear as if he is not listening when spoken to directly, which is one of the DSM criteria for ADHD. In light of deficits in attention and executive function seen in both OCD and ADHD, it is easy to see how a clinician might potentially misdiagnose one condition for another. In fact, chances of misdiagnosis might be even higher in children and young adolescents, whose diagnosis relies heavily on parents or teachers. Consider the example of a child with OCD who sits in class obsessing over an OCD trigger. Continuously bothered by an overflow of obsessive intrusive thoughts, these children cannot be attentive in class and would possibly receive lower grades. In turn, the teacher might perceive the student as inattentive and could report to a counselor and parents that the student might have ADHD. In order to treat the supposed ADHD, a clinician may prescribe stimulant medication, e.g. Ritalin. Several studies suggest that stimulant therapy may exacerbate obsessive-compulsive thoughts and behavior or even induce them. Instead of improvement, child's condition would likely deteriorate. In fact, this may be intuitively explained. Stimulant therapy increases frontal striatal brain activity, which is generally reduced in ADHD but increased in OCD. Stimulant medication will continue to activate an already hyperactive brain, specifically the frontal striatal system, potentially resulting in immediate exacerbation of symptoms. Another possible explanation, once suggested in the scientific literature, is that under the influence of stimulus, individuals with OCD may experience improved attention towards obsessive thoughts, potentially resulting in an increase of obsessions and an increase in compensatory compulsive rituals. Neurotransmission system health. Previously, I wrote an article and filmed a video on OCD and misophonia and explained how a brain neurotransmission system is connected with such neuropsychiatric disorders and mental well-being in general. As we've learned, neurotransmission system also plays a crucial role in ADHD. It is fairly reasonable to apply principles of health of the neurotransmission system to the well-being of a person with ADHD. especially when talking about dopamine, which, as written above, plays an important role in ADHD. I encourage you to get acquainted with the material regarding this matter I have previously provided, since it could just be the key to a drastic improvement. The link to that article is going to be in the current article and also in the video description. Especially for the article and video about ADHD, I interviewed Dr. Mohamed Mongi Mursi, a psychiatrist, on the topic of ADHD. And I also interviewed psychologist Lubov Nikolaevna about the same subject. I, however, have not proceeded with a full interview with Dr. Mohamed Mongi due to the time restriction, but I managed to film a decent bit. Without further narrative, I present to you an interview with Dr. Mohamed Mongi. We recorded an interview with a doctor on our subject, and today here is Dr. Mohamed Mongi.
How are you?
So, the first question is, ADHD is considered uncurable, so the best thing a person can achieve is stable remission, right? So from your perspective, how stable, how long is the best stable remission a patient can achieve, and how long is the usual stable remission achieved by patients with ADHD?
Look, about the first symptoms, ADHD is considered uncurable. We have medication, nothing is uncurable. Maybe it is chronic, it is a chronic disease. It is more logic. But the medication, when you give it to the patient, it lowers the signs and the symptoms. Maybe to a degree it disappears, So he's taking medication, like the diabetes. Without the medication, he have a high glucose in the blood. Okay, taking the medication, the glucose lower until it reaches the normal. But with the medication, so in this case, it's curable, but with medication. But you must take the medication every day.
What I mean is, it isn't curable from the perspective that if you stop taking the medications, it will return back to disease.
This is the name of the chronic. Okay, if it is uncurable, you will give the patient medication and they still have the same problem. Okay, so it is a chronic. From the perspective of stopping the medication, the signs and the symptoms can come back again. Okay, and the disease is very obvious. This means chronic, not uncurable.
But the point is, if you stop the medication,
yes,
the disease comes back.
Yes, this is why it is chronic. Chronic means you must take the medication every day. And from the stable remission, it differs from patient to another, and differs from it is a child or adult. Okay, it differs if the signs and symptoms are severe from the beginning or not, mild, moderate, severe signs and symptoms or not. A socioeconomic level, the parents of the child are taking this as a big responsibility and taking care of his medication and giving his medication every day with the dose as the doctor told them, and there is of course another programming psychotherapy for the child to try to control his attitude. Okay, all of this work together. Okay, to make it to make the medication effective. So the remission also depends on this. And of course, your response of the body towards the medicine. Maybe someone have moderate signs and symptoms of two persons who have both of them moderate signs and symptoms of ADHD and take the same medication with the same dose. This is still stable for 1, 2, 3 years, and this can make a remission after 6 months. So it is not that doesn't have a standard. Nothing is standard for the remission.
Of course. As an Egyptian psychiatrist, how often do you prescribe stimulant drugs to patients with ADHD, such as amphetamine salts? How often such medicines are prescribed here in Egypt?
Look, this is the first type of the treatment. We give this initially to the children because, as you know, ADHD is a disease diagnosed from childhood. Most of them diagnosed from the childhood. So we start with amphetamine salts with a child. Okay, not with adult, because the adult is already must be should we give him the amphetamine salts before when he was a child and didn't give us a good response, so we try him for second line from the start, not the first one for the adult.
What if the adult is diagnosed with ADHD only when he is adult and he was not diagnosed when he was a child, so there is no history
Yes.
of bad response?
No, I mean if he is adult, if he is adult one, when he was young, must be already diagnosed.
But what if he wasn't diagnosed when he was a child?
Maybe we start from the first time, of course.
Was that
But it's very rare to see something like this with a person who will be for 10 years, 15 years having a problem and didn't go to the doctor to see what is his problem. I don't think this is logical.
I'm as an example, me.
Really?
Yeah,
How
I was diagnosed only when I was an adult. I wasn't diagnosed with ADHD when I was little.
When I was a child?
No.
Maybe your symptoms and signs was not severe when you were a child.
They were.
They were?
Yeah.
Even no one from the people you are living with say maybe you have a problem, why not go to the doctor and see if he has a problem or not, make some investigation, take a consultation from a medical person,
Didn't happen.
Very rare, I told
Yeah.
you.
So you proceed with amphetamine salts as a first line therapy for such cases.
Yes, and it give, by the way, it give a good result with the child. Give good is enough for a child. Give good result with a child.
But not with adult.
Result, sometimes not always give us a good result.
Mm.
Maybe it is combined with another drug, but alone not give us a good result. For adult as well.
So you combine it with drugs such as atomoxetine?
Yes.
Psychostimulants are potent drugs, but have nasty side effects. How often are those side effects? How often are those side effects experienced by your patients, and how often are they experienced?
We didn't make a dose, give a high dose to make the patient have a toxicity, or to have a severe side effect. Most of the side effects, passing without being noticed.
So side effects are rare.
Not rare. Every medicine have first generation, second generation, third generation. The second generation have a lower side effect than the first one. The third generation have a lower side effect than the second and the first one. There is always a generation coming up, and the technology makes the side effect more. The more generation, there is side effect. The new drugs, there is side effect.
Yes, I understand. So when your patients experience those side effects, they're not often, but when they do experience them, how bad they are?
As I told you, sometimes I had a rare side effect. Someone have a problem in swallowing. It's very rare to see, but it happened. And we stopped the medication, that was causing this side effect. And within 2 days, he comes for normal and everything passed. I changed it for him with another drug. Something like this, it is a very rare side effect. But of course, the doctor who prescribed the medication must know every side effect, and even the rare ones.
What do you usually prescribe and or advise your patients with ADHD? What's best to take up if you have ADHD?
Look, the early diagnosis is the best. If you want to see a good result, early diagnosis and early treatment, is the best to see the best result on the long run.
I understand, yes. But what do you usually prescribe in your patients with ADHD?
I you know, not like an advice. I try to make them or explain for them the nature of this disease and how it works and what is the things that can exaggerate the problem and what things that make you more calm. I will try to explain for him everything about this disease to can control the disease and can know everything about the disease and how to deal with it. You know, with a crowd, with alone, with a friends, with the strangers.
Yes.
You know,
Understand,
everything.
yes. But what do you usually prescribe as medicines?
Yes, because as I told you, it is, you know, we have a disease in the psychiatry, two types of disease in main. Type of a disease that, you know, the medication is 30% of the treatment and 70% is the psychotherapy and another treatment that doesn't depend on it. Okay? And the other type of the disease, okay, depend on the medicine with 70%. And 30% is the psychotherapy and. So the ADHD is from the disease that depend mainly on the medication.
Yes. But what medication would do you usually prescribe to your patients with ADHD?
There is a first line, you know, as I remember, it was
Mutazapine?
sometimes not only one drug, you know.
Not solo.
No, not only one drug, you know.
Yes.
It is a mix of the drugs to give the best effect. Okay, there is a first line, second line. Sometimes we mix it between the first and the second and third line. Sometimes we mix it between second and third. Sometimes we mix it between both of them, the three of them. It depends, of course, according to the signs and symptoms we see and how the severity of it.
How awful is ADHD in terms of how severe the influence usually is on patients' lives?
Look, in the children, it is very obvious. You know, he can't sit down on a chair. Tell him to sit, he can't sit. For example, a lack of concentration, lack of focus, difficulties in learning, you know, in the school. If you ask him to stand in a row, he can't stand in a row. No patient, no patient at all. It is very obvious. So of course it affects him a lot because even with his friends and with his mates in the schoolmates, he didn't see him as a normal. He's hyperactive. You know, he can't sit down easily. You know, he can't concentrate with the teacher. Okay, so he can't have a good learning. All of this is very obvious, especially the child. So of course it affects the child the most because he will not take the same quality of the education of another child. So it affects him of course in the future.
What proportion of children and adults diagnosed with ADHD is?
What do you mean by proportion?
How many adults and how many children are diagnosed with ADHD? Maybe there are more children diagnosed than adults.
Look, in Egypt here maybe it is 0.5% from the population. I think if it is not wrong with my memory, I think it is 0.5% from the population, but not you know not told as a children and adult. It is all of the disease. 0.5% from all the population.
And from this 0.5%, what is the proportion of children and adults diagnosed with ADHD?
Maybe no, I don't remember the exact number.
Do you often encounter comorbidity among people with ADHD? What other diseases which usually go hand in hand with ADHD are?
Look, sometimes there is OCD, sometimes there is psychotic feature, sometimes if it is a drug abuse, there is psychosis. You know, not sometimes it's ADHD alone. Okay, but ADHD is seen in the children with mental retardation. Most of the mental retarded and having autism, I mean, if the child have autism, 5% he have an ADHD. Okay. If a child have a mental retardation, even it's mild, maybe he have a degree of ADHD, or there is maybe a side the ADHD. With the adult, maybe there is, as I told you, sometimes psychosis, sometimes alone, sometimes with psychotic features, such as drug addict. Not with a certain, not common to see with a certain disease.
By the way, we have passed over
Yes.
half of the questions, so do we continue?
I think maybe it's another.
Okay, so we're finished now.
Yes.
And now I present you an interview with psychologist Lubov Nikolaevna.
Today I'm talking with psychologist Lubov Nikolaevna. Hello, Lubov. Hello, Arthur. All right, let's begin. ADHD is considered incurable. The best outcome someone can reach is a stable remission. From your perspective, how stable and long-lasting can the best possible remission be? And what about more typical stable remission? How long that usually lasts for someone with ADHD and how stable it is? ADHD is a condition that can't be cured because it's tied to how the brain is wired. And that starts developing even before birth. So a person lives with it their whole life. In this case, remission isn't really the right word. It's more about adaptation. Over time, a person learns to live with the brain they have. Also, since our brains are quite plastic, sometimes other areas of the brain can take over certain functions, and that can help someone start behaving in a more or less neurotypical way. Or they can intentionally develop specific skills to make up for what their brain structure lacks, which can also help them function more normally. So, in terms of how long that remission can last, it can actually last a lifetime. If those skills are solid, and if the brain has adapted, it can be stable. But a major stress, aging, or other changes can cause a setback. And when that happens, they'll have to relearn, adapt again, and figure out how to live with themselves all over. As a psychologist, how do you usually work with clients who have ADHD? Usually, I focus on acceptance. More often than not, we're not working directly with ADHD itself. We're working with the consequences. Because their brain works differently, their behavior is different, and that often leads to rejection. People don't accept them. And over time, that builds up emotional trauma, problems, and that's mostly what we work through. It's important to remember that someone with ADHD doesn't have the same kind of attention as a neurotypical person. So you have to adjust for that. They might get distracted mid-session, or need to fidget with something, or even walk around the room. And that's totally fine. It doesn't stop them from talking about what's bothering them. So it's hard for them to accept themselves. Yes. You know, I've dealt with that myself. I have ADHD too, and for a long time I just couldn't accept it. But once I got the diagnosis, it finally started to make sense. I understood what was going on with me. Yes, these days a lot of people say things like, why would you label yourself with a diagnosis? It's a lifelong stigma. But in reality, once you understand what's happening with you, it becomes much easier to live with it. You can start building your life in a way that actually works for you, something that feels more comfortable. From a psychologist's perspective, is it easier or harder to work with clients who have ADHD compared to clients with other conditions? That's hard to say. I've worked with all kinds of people, with kids on the autism spectrum, with those who have cerebral palsy, and so on. Of course, there are conditions that are much more difficult than ADHD, but it really depends on what exactly you're working with. If it's just a psychological consultation, then you need to understand the person's specific traits. You need to pay attention to things like they might walk around during the session or keep fidgeting with something in their hands, like playing with something. Exactly, playing with something. Their attention might seem scattered. Not always, but it can come and go. So, like, very unfocused. Yes, thank you, unfocused. But it can also swing the other way, like a kind of hyperfocus. Yes, hyperfocus. Like I'm doing right now, even this interview. Yes, so it's not always easy because you're working with someone who's fundamentally different from the norm. But at the same time, it's interesting in its own way. I'm glad you find it interesting. That's important. How do you think behavioral therapy is effective for clients with ADHD? Yes, behavioral therapy is very important. At the very least, when you do group sessions, for example, you bring together people with ADHD and they share their experiences, how they organize their lives, what symptoms they have, and that alone can lower anxiety because they see they're not alone. There are others like them. Some people manage it, some even thrive with it. So, group therapy in particular is really helpful for easing anxiety. And it also helps with self acceptance, right? Yes, it actually helps a lot with that. Could you repeat your question one more time? Do you think behavioral therapy is particularly effective for people with ADHD? Yes. Actually, I meant to come back to that word, behavioral. It's really important because it helps the person step back and observe their behavior from the outside, then analyze it, and that can lead to real change. They might adjust how they act and build patterns that actually make their life more manageable and comfortable. What kind of alternative therapies would you recommend for people with ADHD? If we're talking about alternatives, well, for the most part, I'd say time management. It's something they really need to learn because attention is such a challenge. But when you say alternative, what exactly do you mean? Well, I mean things that maybe aren't officially prescribed, like non traditional approaches, meditation, for example. Well, meditation, that's definitely a challenge for someone who struggles to stay focused. It requires sustained attention, which isn't easy for them. I'd probably recommend starting with something like Gestalt therapy or even a more traditional approach. Because when your behavior stands out from others, it leaves a mark. It can cause all kinds of issues: trouble fitting in socially, problems in the family, in school, in relationships. So, first, it's important to work through all the emotional baggage that's piled up because of that. Then, maybe look into group sessions, something that helps with social skills, building connections with different types of people. Trainings like that can really be beneficial. As for meditation, yes, it can be great if they can manage it. That's a big if, though. So, just how common is the ADHD diagnosis? ADHD is actually very common. Roughly 1 in 10 children has it. On average, about 20% of the population shows some form of this brain structure difference. You mean the general population? Yes, the population of a given country. For example, in Russia, the rate is between 15 and 28%. In the US, it's somewhere around 5 to 13%. Would you say ADHD is a serious condition? And what's the hardest part of living with ADHD from your experience? Well, how serious it is really depends on how strongly it shows up. It can be mild, almost unnoticeable, or it can be severe, where it clearly affects daily life. But I wouldn't say it's the worst thing that could happen to a person. It's a challenge, something you have to work through, shape your life around to give it some direction. It's definitely not easy, but it's not a life sentence. So there is no need to be afraid of it. What would you say is the hardest part for someone living with ADHD? Probably connecting with other people. Because when you're not like everyone else, it takes time to realize that you're not bad, you're just different. How common is ADHD in adults compared to children? Let me go back to what I said earlier. ADHD is a difference in brain structure. So if someone is born with it, they'll have it for life. It might look different in adulthood, though, because over time people learn coping strategies and build skills that help compensate. Sometimes even age-related changes can work in their favor. Or the brain adapts, thanks to its plasticity, and brings their behavior closer to what's considered typical. But the root of it, what they were born with, that never really goes away. I've read quite a bit about ADHD, and from what I've gathered, it seems ADHD is diagnosed less often in adults than in kids. Some experts say it's because the brain actually adapts over time, so the symptoms show up less. Others believe ADHD just kind of disappears, so there is no clear consensus. There is also this point. Someone with ADHD might have less concentration at first, so they take longer to learn things that come naturally to neurotypical people. But given enough time, they do learn them, and as they grow older, they might end up seeming pretty similar to everyone else. Right. Okay, how common is comorbidity in people with ADHD? What other conditions usually show up alongside it? ADHD often comes with quite a few comorbid conditions, actually. For example, people might also experience tics, depressive disorders, or full-on depression. There can be developmental delays, both mental and speech-related. Learning difficulties are also pretty common, as well as emotional regulation issues. And on top of that, Substance use disorders can sometimes be part of the picture too. What would you like to say to people with ADHD? I'd like to say you're wonderful people. You just need to understand yourselves, accept who you are, and learn how to live in harmony with that. On that beautiful note, we'll wrap up our interview. Thank you, Lubov. Thank you, Arthur. It was a pleasure talking with you. Me too, thank you.
My history with ADHD and lots of other stuff. I was not diagnosed with ADHD until recently, when I realized I have ADHD and booked a psychiatrist appointment to confirm it. Although I do have ADHD all my life, I can remember. It's just I face much more exhausting and challenging health issues, and nobody found out a cause of my ADHD symptomatic picture in my childhood, which was there all along. I have ADHD, predominantly inattentive type, and boy did I get a great time with my condition. I always had difficulties sustaining attention, I constantly daydream, and my ADHD greatly synergizes with my OCD to ensure my focus is very easily distracted by unwanted thoughts. I have a complex clinical picture with OCD and ADHD entangled and diffused as it was an unthinkable alloy of intrusive, obsessive-compulsive noisy thing. I was often told that I am inattentive, do not listen when spoken to, always daydream. I was often accused of such, shouted at when I was small, etc., since I was little. Years went by and my health issues were piling up. When I was about 19, I, through combining antibiotics and experimenting with diets, somehow managed to screw up what appears to be my neural connections between my GI and brain. At least that's what I've been told by doctors when I went through a series of thorough tests to check if my GI tract, like hiatus hernia, is somehow responsible for the nausea I acquired back then in 2017-18. Long story short, ever since the end of 2017 I suffer from nausea and limited appetite. I have a constant nausea at lowest levels, aggravating to much stronger nausea should I eat more often or more in quantity than I should, or if I drink water or something non-acidic or be stressed, etc. My life has changed ever since. It was already quite grim ever since my OCD started growing back in about 2012, especially before I discovered the system of keeping OCD at bay. I spent years now developing a system to keep nausea at bay. It was a lot of time, effort and suffering. Years of being unable to eat normally, feeling the nausea that just won't go away. It's hard to describe it at this point. First I thought this was a symptom of gastritis and tried to treat myself with PPIs. Well, it turns out lessening the stomach acid only aggravated the problem drastically. There were times when I ate only some small portion of cold oatmeal and water and sometimes a banana, still feeling nauseated. Of course, there was a significant deficit of energy and nutritional intake. I was very slim and struggling to be, as I, of course, felt fatigued due to lack of calories, and still tried to go to gym. When the stomach got healed almost completely and a couple of years passed, it was apparent the stomach lining wasn't the problem. The main suspect then was hiatus hernia, but this was refuted at a later point in life. Regarding the nausea, it got only worse when I developed the second kind of nausea, now associated with problems with the intestines, which is even worse. This battle goes on per this very day. Hello from 09/07/2025. I'm much better now. Although the nausea and lack of appetite did not go away completely, the condition improved on my meds since around 2 years ago. But what I was leading to is that after I developed the nausea, I also developed self-blaming character due to Pavlov's dog's conditioning phenomenon. When I made mistakes, such as when I drank water or tea after food, or when I tried to eat something in between meals, or when not being hungry or more than I required, I entered a nauseous state where my background nausea increased tenths of fold and wouldn't disappear for hours, sometimes days. Immediately I started blaming myself because obviously I did not want to feel lasting nausea. As time went by, self-blaming became a habit. The more time passed, the more grew this phenomenon. I started blaming myself for virtually everything, including ADHD symptoms. I told myself horrible things. I told myself I was defective, unable to do anything right. I blamed myself for ruining my own life. And this did not end at worse. This went on and grew pretty grotesque. There were increasingly frequent and continuous meltdowns, as I went psycho on myself. I was involved in an abusive relationship where my constant self-blame was aggravated and used against myself. It was a treacherous mechanism, a large psychological hook, thanks to which I thought I was the problem, as I always was. My crumbling sense of myself and self-respect were challenged even more. In this relationship, I allowed grotesque things to happen, and afterwards, in order to forgive myself, I told myself I'm never going to treat myself this way again. When you treat yourself badly, you allow others to do the same thing. Sick bottom line here I was leading to is that if you suffer from ADHD or any other health disorder, you are not defective. Your brain is wired this way. It is not your fault. You are not wrong to be inattentive and forgetful. You are not wrong to have impulsive urges. It is, however, under your control to attend CBT sessions, take your meds, visit psychotherapists. But that doesn't mean you must do it, or magically and abruptly become an attentive and non-forgetful and non-impulsive person. Your disorders are not signs of inferiority. On the contrary, they show how strong you are to withstand hardships, that you can live life and go forward in spite of such difficulties. Well, this article and video were made during OCD relapse, hence the pause. And you know why? Because I was not following the clean brain strategy. When it comes to neuropsychiatry, it is really important to keep your brain in a healthy state. Thus, I very much encourage you to check out my article which explains this subject. The links will be in the current article and in the video description. At Sci Club, you can expect further major articles accompanied by videos on various science and health subjects, as well as debunking pseudoscience, bad science, and just pure nonsense people tend to believe in, which also tends to cost them a fortune. You can already find various hard scientific articles on the website, which usually come in Russian. Sci Club is a source of reliable science, the information that is fact-checked and well-referenced, information that will not be silenced. The project is evolving rapidly and expected to grow vastly. You can subscribe at the website and on the channel not to miss out on something important and or interesting. This video was not funded by anyone and does not include any paid or unpaid promotions. You are welcome to share and distribute this article and video if you properly reference its author, me, and source. It's been more than a year since this article and video is under production, and the main reason for this is me searching for an English-speaking psychologist to take an interview from, which, as it turns out, isn't exactly an easy task in the town of Hurghada. I was waiting for one great psychologist I know to free up, which led me nowhere. Eventually, I discovered another great psychologist with the same name, and after a while filmed an interview. Although Lubov, the psychologist, did not speak English at the level satisfactory for the interview to take place, and the video had to be translated to English. All that being said, all the process finally over, and you can expect new articles and videos coming faster next time.